بسم الله الرحمن الرحيم. بس to recap the stories back, if you can remember, we have started talking about the drug used in lowering hyperlipidemia, and we have talked about 3 drugs already. We have talked about statins with all the details that we talked about, and then we mentioned the niacin, and we talked about the fibrates. Now, generally speaking, many cases that we're facing here, the patient may not really have a good response toward statins, or maybe have a partial response toward statins. So we need to sometimes to add a drug toward the statins. We mentioned that the fibrates has a problem in increasing the rhabdomyolysis and myopathy incidence, generally speaking. وحكينا انه we said that the gemfibrozil is a drug that contraindicated, generally speaking, with the statins, and statins themselves has an issue with myopathy and rhabdomyolysis. Then we turned toward the niacin, and we said the niacin is falling out of treatment of hyperlipidemia. Now, and we mentioned the fibrates, and the fibrates is really directed toward very low density lipoprotein and triglyceride rather than the activity against the LDL cholesterol. Now, what other option that we have in terms of lowering LDL? And we have 2 drugs. We have, let's say, 2 groups of drugs. One drug bind toward cholesterol within the GI tract, and the other drug bind toward bile acid within the GI tract. Now, if we bind toward the bile acid within the GI tract, we will increase the excretion through the feces of these bile acids, and we will need more cholesterol to synthesize a new bile acid. So we reduce the cholesterol level, generally speaking, and this is a nice idea. And those drugs called a bile acid binding resins. It's like resin يعني صمغ بيرتبط بالبile acid and excreted out of the cell. What are those drugs? They are, let's say, cholestyramine here and cholestyramine. 2 drugs well known, well tolerated. They are good drug, generally speaking, although they have many side effects. However, they don't have a real strong side effects. The whole side effects coming through the GI tract and the absorption for other drugs. So those drugs, the first thing we need to say that those drugs will be taken with food because they interact and they react toward food, generally speaking, and the activity of the bile acid through the absorption of drugs. So the bile acid will be excreted more on the time of food intake, so we take those drugs with food. Now, the cholestyramine, I'm gonna read now. Cholestyramine and cholestyramine have a significantly LDL cholesterol lowering effect through the benefit, although the benefit is less than those observed the statin, so they are not better than statin, they less efficacious than statin. However, we add them toward the statin in those drugs, in those patients that do not really respond toward statins. Now, these agents are resins, means they have ability to bind toward bile acid, that bind bile acid in the intestine, forming insoluble complexes that will be excreted in the feces. Lowering bile acid now will trigger the conversion of cholesterol into the bile acid, and the end result will be the reduction of cholesterol concentration within the body, because bile acid build through cholesterol, and cholesterol is a part of bile acid, so we end up in reducing the LDL, generally speaking. So the therapeutic uses the bile acid binding resin are drugs of choice, often in combination with are the drugs of choice in combination with diet or niacin in that type, which is called type 2A, and you go back toward type 2A and you find it's a high level of cholesterol, generally speaking, which is the hypercholesterolemia. generally الجدول اللي حطيناه في المحاضرة بتكلم على الفاميليال type of hyperlipidemia. This is the mechanism of action. This is the cholestyramine. It's go toward the gut binding and excretion of bile acid. The liver will respond now, gonna increase the synthesis of bile acid synthesis, and that gonna increase the consumption of cholesterol at what you want, generally speaking. And understand now, if we increase the consumption of cholesterol, you may have an activity toward the LDL receptors. Also, it's not the real, known mechanism that it will increase the LDL receptors. However, it will decrease, generally speaking, the LDL level within the body. What we get, generally speaking, as a side effects, we will have a special side effects now, and you need to understand that those drugs will disturb the GI tract. They cause constipation sometimes and nausea. The other thing that we need to understand, that bile acid is important for the absorption of many things, من ضمنهم, including, the vitamins. So the fat soluble vitamins A, D, E, and K will be impaired for absorption. So we may have a problem with those stuff. So we have to monitor those vitamins. These agents also interact on the absorption of many drugs, which is the fat-soluble drugs. And you understand now, when we talk about digoxin, it's a big matter. Warfarin is a big matter. Tetracycline, maybe yes, maybe no. Aspirin also. So those drugs have built their absorption on the bile acid, and when you excrete the bile acid on time of taking those drugs, that would be a problem. So how to solve this issue? Generally speaking, we will take bile acid at least 1 to 6 hours after. So drugs should be taking at least 1 to 6 hours after the bile acid sequencer. Just to remind you, bile acid taking with food, not like statin. Statin, usually we like to take it at night. Why? Because we're inhibiting the cholesterol synthesis, and cholesterol synthesis, generally speaking, happening during the fasting time of sleeping, or the low metabolic time of sleeping, and this is important to understand. Now, what's the end results of this bile acid sequencer? They are a good inhibitor for reducer for the LDL receptor, the LDL level within the blood. So they add on activity toward the HMG co-reductase, meaning statin. So we usually use them with the statin or without statin. We may need to use them with niacin sometimes to reduce the LDL and increase the HDL and reduce the triglyceride and so forth, so on. Bile acid sequencer, generally speaking, بسهولة الكلام, we add them to the statin. This is the situation that we're talking about, to increase the activity of the statin. Although there's many other drugs that we're going to talk about in the second lecture, about the new option to improve the activity of the statin. However, bile acid sequencers is still in the market. However, we need to understand they have some side effects and some interaction with drugs, vitamins, and so forth, so on. Now, the second type of drugs that interfere with cholesterol absorptions, it's called cholesterol absorption inhibitor, and those drugs, generally speaking, they're mild. If you see here, we're going to talk about a drug in a minute, but just not to come back to this slide again, you remember cholesterol absorption inhibitors have a mild activity. Why we want to use those drugs, doctor? We need to interact with something else rather than we reducing the level of LDL and increasing the HDL and very low density LDL. In a minute you're gonna understand what I'm talking about. Izetinib is the drug that inhibit the absorption of cholesterol from the blood selectively. So izetinib is not interacting with bile acid, it interacts with the intestinal absorption of dietary and biliary cholesterol in the small intestine, resulting in an increase in the clearance of cholesterol from the blood. What's happening in reality with this drug, it's really a very interesting idea that this drug is a good combiner toward the statin. So just to make things clear, this drug have a little side effect, have a headache and diarrhea, have a very limited activity when we use it as alone if we use it alone. زي ما شفنا بس سهم واحد عم ينزل الأشياء، لكن لما عملوا له combination with statin, they find that there's a synergistic activity. Again, there's a synergistic activity toward the reduction of statin, toward the reduction of LDL cholesterol. So we reduce the cholesterol more and more when we combine this with ezetimibe with statin. Why is that? Because when you inhibit the synthesis of cholesterol within the liver, there is a, let's say, a feedback absorption of cholesterol from the GI tract. So this is one of the compensatory mechanism toward the statin inhibition. So the statin will inhibit the synthesis of the cholesterol, and the synthesis of cholesterol will call, inhibition will call the LDL to increase expression, and the LDL will collect the cholesterol from the GI tract, the blood, and will increase the HDL to collect again the cholesterol from the blood. However, there's another mechanism that may happen, and that mechanism is increasing the absorption of cholesterol toward the portal vein and so toward the blood. So ezetimibe, if we inhibit this, we will produce a more activity toward the statin. So ezetimibe is a drug with little effect, with only one arrow. However, it will really add on maybe towards synergism when using with statin. So this is what you want to remember. ezetimibe حتى انه الان في دواء we have a drug that combine ezetimibe and statin within the same pill, and this is a very interesting idea. So that's all in terms of all drugs. وهاي تكملة المحاضرة الأولى حقيقة. فبس just to recap the stories back, we talked about those drugs. Statin is HMG co-reductase, okay, with all the application, with all the side effects. If we combine ezetimibe with this statin, we will increase the activity of the statins, maybe synergistic activity. Okay, remember, maybe synergistic activity. If we use ezetimibe alone, we will not produce a real effect. We will only have one arrow in reducing LDL and VLDL and increasing HDL. It's very minimal if we have anything. Now the other option is the bile acid sequencer, and this is combined. إذا بدك تحفظوهم ezetimibe, bile acid taking with food because they interact with the cholesterol, and bile acid and statin taking before sleep. Fibrates, it doesn't matter where you take them. However, they are directed toward very low density lipoprotein, and we talked about the niacin with this special activity against toward the HDL and increasing HDL and reducing LDL through the effect on lipoprotein. We said hormonal dependent lipoprotein within the body, and so forth, so on. This is all about the old stuff. and هذا الجزء الأول. راح أبعث لكم الجزء الثاني اللي هو new anti hyperlipidemic drugs. وجزاكم الله كل خير.